Hello everyone, my name is Dr Penet, MD. I'm a neurosurgeon trained in Paris in spinal surgery. I'm currently a fellow in a spine center in Switzerland, in Lausanne. And I'll gladly today speak about virtual reality and new devices that have been developed in order to teach residents in spine surgery. And for example, the transforaminal lumbar interbody the famous TLIF, minimal invasive technique. Well, TLIF, which stands for transforaminal lumbar interbody fusion, is part of minimal invasive techniques of spine surgery. It's been developed in order to to reduce the invasivity of previous open techniques, along with keeping very high decompression possibilities of neural structures. In this more and more legal environment that we have in the pedagogical point of view of the healthcare system, meaning training our residents, they cannot stay in the hospital 100 hours a week as we did us before. And we need to be able to provide a pedagogical device that they can use outside the working hours and that they can do and redo to the infinity, devices that are reproducible. In those devices, in those procedures that we try to implement, we can add scenarios with complication, for example, in order to develop soft skills technique. And they can develop with that kind of haptics device cognitive skills, of course, but technical skills. They can improve their technical competencies. So it's well adapted, and moreover with the COVID era, in the pedagogical point of view of surgeon and spine surgeon and every kind of medical resident. Providing XR simulators is very important in medical training and moreover in surgical training because, as I said previously, you can use them outside the working hours, and you can use them an amount of time indefinite. You can use it as it is very reproducible, and you can complete a full training and gaining competencies that were very difficult to obtain with cadaver lab. So the targeted audience for that kind of simulator, which is a surgical simulator for a procedure called the TLIF, is obviously young surgeon, first or second year resident, and this will give them the opportunity to develop competencies and to apprehend completely the procedure, meaning they are going from A to Z, from the very beginning, the skin incision, to the skin closure, and being able to understand every step of the procedure in one point of view. On the other point of view, with a haptic feedback arm, you gain technical competencies, meaning that you can use the carry sound, for example, and have a real-time feedback of what you're doing during the surgery. For screw placement, you have the pack needles, the Jamshidi, and you can have real feedback of the positioning of your screw. So it's a very good training because it's very close to the real life. It's not the real life, but we are more and more close to the real life. So what is unique with a Virtually Surge simulator is obviously the fact that we use haptic feedback arm, this robot actually. You can put on this robot any kind of surgical instrument, and you can switch them from the pack needle for the screw placement of percutaneous procedures to the removal of bone as laminectomy or facetectomy, for example. And with that, you can use every kind of instrument and implement any kind of surgical procedures in order to get closer to the real life, what happens really in the operating room. We try with this simulator to recreate the technical move the resident, the surgeon, has to do in the operating room. That's what is very innovative. So what is very important to understand with those kind of simulators, and that you can get the cognitive knowledge out of it. You can understand, apprehend surgical procedures. So the resident, when he arrives or she arrives in the operating room, she knows exactly what's going to happen. On the other side, with the robot, you will be able, with that kind of device, to develop your technical skills, meaning that you're going to be sharper, more precise, and you will be able to train before doing it with a microscope or on a real patient previously with this device. That is very important, and that is the main point to my mind. Well, that's a very good question. Data analysis and machine learning is one of the main focus of these simulators. Why? Because when the surgeon, the trainee, is actually doing the simulation, we can extract every single data of the simulation in order to provide particularly a very accurate feedback of what is being doing, what kind of progress is been making, and what are the main axes of focus for progression in the future in order to once again optimize the care provided to the patient in the OR. This will be able, with the machine learning, to provide the most accurate pedagogical device possible. It's one of the main focus of virtual research.